Welcome to a new episode of Science in Context. I'm Sabine, and this week, Dr. Anne Cori and Professor Neil Ferguson join me to speak about research on preparedness and response to emerging threats. Neil, what does this research focus on?
Well, the last decade has highlighted that we're constantly at risk from new, what are called emerging infectious diseases, COVID pandemic being the largest one, but there are many others. And for many years, the MRC Centre has focused on developing tools and models to respond to those threats more effectively. And here we're building on the lessons we learned in the COVID pandemic to take that work forwards.
And were there any specific research gaps that the pandemic identified?
Quite a lot, but one of the key ones we identified and was identified by many groups was the fact that the pandemic had differential effects on different people in society and different groups in society, which whilst we captured that statistically during the pandemic, sort of mathematical models of disease transmission we develop don't properly capture that heterogeneity, for instance, by a minority ethnic group or by socioeconomic status. And yet we know those things had a big influence on people's ability, for instance, to work from home, their exposure to the virus and their health outcomes. And we'd like to address that going forward.
And we've recently seen outbreaks of mpox and cases of avian influenza and swine flu. How will your research help address these challenges?
Well, these events re-emphasize the need to put in place effective surveillance systems. During the COVID-19 pandemic, the UK, for example, went from very poor surveillance at the start with too little data really to effectively monitor the epidemic, to having one of the best surveillance systems in the world with sometimes too much data collected. So research is needed to identify the sweet spot between those two extremes. This should allow rapid detection of future threats based on surveillance in animals as well as humans, but it should also enable characterizing transmission and severity and tracking the impact of interventions. To do this, we need to quantify the value of information so that we know what and how much data is needed to answer what scientific or policy question.
Thank you so much for your time today.